It's the This is Gladys show, and I'm Gladys, and this, my furry friend, is Marco. And if you've seen the show before, you know that Marco has been my co-host. Doesn't he look great? Say hello. Marco has more fans than I do. And a little story, can we tell a little story today what happened? We were in the street, and I walked by this woman, and she came running back to me, and she said, "What kind of dog is that? Looks like a lamb." I said, no, this is not a lamb. This is an apricot poodle, but he has long hair, you see. I had his hair cut by me. I cut his hair today. And didn't I do a good job? Look at this haircut on this dog. Long hair. And Marco said to me, what I say to my hairdresser, now don't take too much off, and I didn't. But look at me today. Last week I had hair down to here, and I went to the hairdresser today, and I said, just a little trim. So I closed my eyes for a minute, woke up, my hair was on the floor, but now it's short. But I came into the studio tonight, and all the guys said, gee, it looks great. So I'm happy, and this is going to be a great show, because Marco helped us pick the guests, and we have two terrific guests today. The first guest that we're going to hear from a little later on is Dr. Robert Bard, and Dr. Robert Bard is a radiologist whose specialist is ultrasound, and we're going to be talking about mammograms. We're going to be talking about saving your breasts. There's been a lot of controversy about mammograms, whether it's good, whether it's bad, age, and Dr. Bard is an expert and a pioneer of the field of ultrasound and radiology and sonograms. And our other guest is a wonderful actress. I went to the theater last night and I saw a play called Volpone. I'm not even sure I'm saying that right. Off-Broadway, and I went backstage because I was amazed at this woman. She would be my idol, and her name is Ruth Ann Garrity. And we're going to meet her and Dr. Bard in a little while. But before we meet our two fabulous guests, I want to talk a little bit about New York. I'm a native New Yorker, and sometimes I talk on the show about terrible things that happen in the city, robberies and all the negative stuff. But I just want to talk about something really positive. For most of you who have seen me know that I do stand-up comedy, and I have a comedy room at Hamburger Harry's, 145 West 45th Street. We're there 3 nights a week. Okay, last Saturday I was emceeing in my room. We had a great show. I finished and went to dinner. And I'm sitting at dinner, and suddenly, do you know how things happen to you? Illnesses happen all of a sudden. Suddenly, I went into terrible pain in my face, in my ear. My ear felt like it was on fire. I had never experienced such pain. And I thought, well, no, I'm not going to take care of it now. I felt, you know how you feel foolish sometimes when you're sick? And suddenly I thought, no, I better go to the emergency room. But I'm afraid of the emergency room. And I went to Manhattan Eye and Ear Hospital emergency room. And I have to tell you, I have never had such good care in my life in an emergency room. They took me right away. They took my blood pressure. Thank God it wasn't a stroke. The doctor came in, gave me a fabulous examination, and then he said to me, well, I don't see anything serious, but do you talk a lot? I said, yes. Do you eat and chew a lot of gum? I said, yes. He said, well, if you want to get better for the next week, no talking and no chewing. I thought, oh, my life is over. But the reason I tell you this story is because we don't take care of ourselves enough, and we wait until the last minute. And now the city is filled with emergency rooms. So what I can say to you and share my knowledge that I now have, there are great emergency rooms around the city. 2 in particular, Manhattan Eye and Ear, if you ever have an ear, nose, and throat problem, they're wonderful. And Sloan Kettering, which is a wonderful cancer hospital, not just for cancer, but you'll be treated great. Check out the emergency rooms in your area or anywhere in the city. Find out how long you have to wait. If an emergency, what is an emergency? Does your leg have to be off for you to be taken care of? Check it out, and the message here is take care of yourself, okay? It's very important. And speaking of taking care of yourself, we have our first guest here. And he's going to tell you how you can take care of your breasts. And sitting with me is my friend and Dr. Hi, Dr. Bard.
Hi,
how
Gladys.
are you? It's good to see you. I saw you last week. I came in for I go like 3 times. How many times do I come in, do you say, to your office for a sonogram?
Oh, a few times a year.
A few times a year, okay. And I went in and I had a sonogram of my breast and a new thing called the Doppler, where I saw my breasts in color. And I'd tell people what I never knew what it was until 15 years ago when I met you. What is a ultrasound specialist? What do you do?
Well, ultrasound comes from looking at sound waves inside the body, basically the same way you see a submarine. in the water. With sonar, we get the same pictures. We send out sound waves and we get pictures of what's going on, cysts or solids.
I'm going to put the dog, I hate to interrupt you, but I'm going to put the dog down so I can, go ahead.
Yeah, so now we can see cancers and benign disease in the breast in a few seconds.
In a few seconds, and it's all done with sound waves, is it?
Sound waves and computers.
And what is it used mostly for today?
Well, ultrasound is used now in every part of the body. It first started in babies. We could actually see babies moving. And then it went into the eye, the thyroid. It's used extensively in the heart,
right,
in the abdomen, and now we're diagnosing prostate cancers and kidney disease.
So how many different parts of the body is sonar used for today?
Well, it's used for almost every part of the body except the lungs. It doesn't go well through air-filled structures like lungs.
Speaking of the lungs, I want to really be specific today because there's a topic that concerns a lot of women and me, and that's breast cancer. And from what I know, breast cancer is the second killer, biggest killer in women. First is lung cancer. More women die today of lung cancer than, and second most is breast cancer. But I understand that you have now been using different modalities in your treatment of diagnosing breast tumors. Can we talk a little bit about that and what you're known for?
Oh, absolutely. When I first got into this about 20 years ago, I remember I gave a lecture at Memorial Hospital to the breast surgeons, and I said, when all else fails, try this technique. But now when I lecture, I say, if any woman is under 50 or any woman has lumpy breasts, try this first.
Right.
Because we're finding that it picks up tumors much faster and quicker and more accurately than mammography. As a matter of fact, I had a case, this was about 5 years ago. I had a woman, she looked young, but she wasn't, and she had lumpy breasts, and I said, look, I can't see anything on the x-ray, but on the sonogram there's something, and I don't like it.
Yeah.
I really don't like it.
Well, I came to you, I don't want to date me, but like I was diagnosed almost 15 years ago. I went to the doctor, and I found it myself, a lump, and when they said it has to come out, they didn't know what it was. Chances are it wasn't cancer, but there was that 5% chance. And my gynecologist then said, I would like to send you for a sonogram, and I thought, oh my God, what's that? You know, he said, don't worry, and he sent me to you, and you told me that I didn't have to worry and explained to me that you could see, and I was in my 30s. So what they're saying, are you saying that, and women in their 30s do get breast cancer. I had a friend who died at 39 at breast cancer. So are you saying, the article in the Times said that women between 40 and 50 should not have mammograms? What should
40 to age 59. They said that mammograms may not be useful,
right,
but the point is, a mammogram certainly is useful if it finds your cancer. But more importantly, there are better tests for diagnosing breast disease. Let me go back to that woman who I said,
right,
you've got something there, but I don't know what it is. Well, 6 years ago when we were doing this really accurately, I sent her to some physicians and they said, we can't see it on the mammogram, we can't feel it. So they waited. And they did a mammogram every year for 4 years, and then finally the cancer showed up to the field and also to the mammogram. So ultrasound works, and it's been more accurate than mammography in diagnosing cancers. Every study is coming out showing that it works better.
So you're saying, though, basically, can you rely on one modality over the other? You have the three modalities that I know of that you tell me I should use is the sonogram, which you can have as often because it's non-invasive, right? And a mammogram for me, right? And also, what is this thing called the Doppler? I saw my breasts in color.
Well, that's good, because what does color mean? In ultrasound, color shows blood flow. So where do you get increased blood flow? You get it in cancers. Since it's growing, it needs more blood vessels, and that's what we can actually see. So while ultrasound by itself is really good, we can look at areas that we're really not quite sure about. Instead of saying, as we used to, come back in 6 months, or stick a needle into it at the time, we can actually flip a button on the machine, and if there's blood flow, that is, if it's a cancer and there's blood flow going into it, the color will show up beautifully. It'll show up the blood flow and you say, ah, this has got to come out.
If you see something on the it's a monitor that shows the picture, right? You can see it right away.
TV screen.
Do you tell the patients that you've seen something, or do you tell the patient what you've seen because they ask you, or do you call the referring physician, the person who referred?
Well, you let the patient know right away what the problem is, because if it's serious, you say, I say, this is a problem. Right. Go back to your doctor and get it operated on right away.
Okay, the other thing, just one more question. I just wanted to show some pictures, videos that we have of healthy and malignant breast. I ran into a woman today in the store, and I told her I was doing this show, and she said, oh, I just remember I have to call my doctor. And she was very concerned because she's on Medicare, and she said that they're not going to take her insurance anymore because they're telling her she's like 60 years old, and they said, oh no, you can't have a mammogram once a year. You have to have it every 2 years. I mean, my question is, do you take insurance also when you practice? You will take, so people can, and you do the mammographies, all of it now?
Yes, we do mammography as well.
Okay. I just wanted to show here, I didn't understand this, but I got these last night and I looked at them, and what it looks like and how you can tell a healthy breast from a breast that has a tumor in it, or might be a malignancy. So I mounted these. I don't know if I did a good job, but maybe I'm going to hold it up, okay? And maybe you can tell what it is. I know the top is a benign breast mass, okay? So.
That's right. You know, most lumps in the breast are benign. About 99% of lumps are absolutely nothing. They're either this type, you see it's outlined by white, and it's sort of got tiny bright spots in it. This is the skin, the black is the fat of the breast, the white area is what we call breast tissue, and here's the tumor. Now what's important and differentiates this from mammography is, on a mammogram, the picture of the breast is white, and the picture of the breast cancer is also white. That's why it's hard on lumpy breasts, which are white, to pick up a breast tumor, which is white. White on white doesn't work. Now on the sonogram, what does the benign tumor look like? It's black, but you can see it's smooth and well outlined. Now if we can look at this one.
What is it? That's a total benign breast cyst.
Yeah, this is the kind of benign tumor that you get when you're on hormone therapy. When women are on hormones, they develop lumpier breasts for one, and they develop benign tumors in the breast, and you can tell with the sonogram in a few seconds that it's nothing. Go home and spare them surgery or even more mammograms. So a simple cyst, which is down here, you can see it's completely black and very, very sharp and clearly marginated. So that's what a simple benign cyst is. As a matter of fact, nowadays when we see cysts in the breast that look like this, we leave them alone. We don't even stick a needle into them, because we found that sticking a needle into breast cysts, about half the time they come back. So if you're sure it's benign, we're pretty sure. We just say, go home, come back in a year or 6 months if there's a family.
Okay, and this one is, this one is what we dread to hear, and this is a malignant.
Yes, well, the good
mass.
news in breast cancer is if you catch it early, if you catch it under what's called 1 centimeter, or about ½ an inch, you can completely cure.
Really?
Total
cure rate is high.
If you catch it early.
So that means if a person takes care of themselves and knows what to do, like preventive, like we have the pap smear. People go for a pap smear. People now say that people should, over a certain age, should have a colonoscopy. People should have it in their heads, Dr. Baud, right? How do you put it in a woman's head to take care of herself? What are the things that she should do if her doctor isn't telling her what to do about breast care? What would you recommend?
Well, let's look at this picture, because this is what the cancer looks like. You see it's black on white, so it's easy to see, unlike mammography. This is irregular, ragged, like a crab eating away at the normal tissues. So once again, here we have a cancer, very easy to see. So what I would tell women is, first of all, take care of yourself. Be proactive in your care. If you feel a lump and your doctor says it's nothing, get it checked out, because the fingers miss, even the mammograms miss. So you can get a sonogram. And the good sonograms will really show what it is, and we can tell the patient at the time we do it that this is something you have to take care of it.
Okay, and just one other thing. I know when I had a mammography, they took my breast and they compressed it in this machine, and it's sometimes painful. But ultrasound, what is it that you use just to...
Well, we use a simple microphone-like probe that goes over the skin, so it's painless and it's quick.
And it's all over your own body. You know, this has been really informative, and I think we're going to put up your name later and address and phone number if you have any questions. And also, we don't have time, but I have a little do-it-yourself info thing. A lot of people don't like to touch their breast, but this is really very simple, and if you call or write me, I'll be able to give you some more information and maybe send you one of this, okay? So this is it. This is our segment, Dr. Bard, and I want to tell you, you've been a great guest, and I will see you next week for a mammogram. See? Thank you.
Great.